Welcome everybody to GoLocal Live. I'm Josh Fenton, CEO and co-founder. Apologize for being late with Dr. Fine. We were waiting for the governor's press conference to conclude. Obviously, last night in Providence was as violent a night as we've seen in this city in about 40 years. Thousands and thousands of dollars worth of damage at small retailers across the city. Providence Place Mall, badly damaged, 60 or 70 stores broken into, probably millions of dollars in total damage across the city. Police, both from Providence and the state police, as well as Massachusetts State Police and police officers from around Rhode Island, were on duty last night, about 150 in total, and 65 arrests. 35 of them are Providence residents. Another 25 are from elsewhere in Rhode Island. Only 5 of them are from outside of Rhode Island. So this was no outside terrorists coming into Rhode Island. This was homegrown. The pictures you can see on GoLocal are just really a sad situation of the amount of destruction that they did throughout the city. There's also video of last night's events. This morning, there's a number of new updates, including just recently that the governor, after not responding to questions all morning, announced at about 11:30 that she will be deploying the National Guard for the purposes of security. That order took place today, and expectations that they will be deployed immediately. There's concerns about this weekend of an event. Also, these are not protesters, these are rioters. She also said that there is a chance of issuing a curfew order in Providence for Friday or Saturday night. So stay up to date on this on GoLocal. There's probably 9 or 10 stories since last night, 10 o'clock last night. We broke this story about the deployment of state police and Providence police throughout the city in anticipation of the rioting, but there's probably 9 or 10 stories and videos on the site, and please stay tuned. Let's go to our other crisis, the coronavirus, and Dr. Michael Fine. Dr. Fine, thanks so much for joining us.
Nice to be here, Josh.
Okay, so we've got rioting in the streets throughout the country, in big cities and now in mid-sized cities, and stress is at an all-time high level from both a standpoint of public health, economic crisis, and now rioting. What's the implications of this from a public health standpoint?
Oh, man. Well, the stress is going to be quite difficult. You know, the challenge is making sure that in the middle of this, we can attend to people's physical health the way we always have, and that we get people who are sick into care quickly so they don't sit at home and get sicker. That's both for coronavirus and for everything else. Coronavirus hasn't gone away, and it's not going to go away just because the numbers are a little less. We got to keep our eyes on this ball and make sure people have access to the information and care they need if and when they get sick.
Dr. Fine, obviously, if you saw the video from last night, you see masses of people, many of them wearing masks, but obviously social distancing is out the window. And then it's just tremendous interaction between law enforcement and rioters, obviously making arrests, chasing, grabbing, all the rest of it. Police officers have to be at tremendous risk in this situation.
Well, you know, but I think the bulk of the risk is actually from the conflict, and the bulk of the risk is from, you know, just the situation, which is so difficult. There are obviously some risks about the transmission of the disease, but I think those risks are relatively small compared to the risk of the violence itself. You know, like I said, there is some risk and there may be some disease transmission, but you know, the only good side of this is I suspect most of the people on most police and also most of the rioters are way under 60, and that means that should anybody get infected, it's not likely to be a severe disease.
Yeah, I did talk to a number of high-level state police officers who are in their 50s in the command staff last night and early this morning. And I think the physical exertion of this type of interaction, which functionally we haven't seen in Rhode Island maybe since the early 70s, and some rioting that took place in Providence during that period of time. We've not seen this before.
Yeah, and I am having trouble remembering anything like it. I mean, the last time I can remember it clearly was the late 60s, after the death of Martin Luther King, after the death of Bobby Kennedy. That's when this kind of thing happened before, but that was a very different moment. That was not what appears to be people looking to make trouble. That was people acting out of rage and pain. And there is plenty of rage and pain, after the murder of George Floyd. Yeah. But to have that rage and pain, that legitimate rage and pain, co-opted by something else is really troublesome. It's like we can't let our partisanship stop. We need a moment of connectedness and healing, and this is going to disrupt that fairly profoundly.
Yeah, I think a lot of this, law enforcement say, it was just straight out thievery. Just a lot of young people looking to steal computers from Apple stores and sneakers from sneaker stores. And this wasn't ideological in mass. Maybe some of those that organized it, maybe some of those that initiated the violence, but a lot of it was just thievery.
Well, you think about thievery on the front end, but I worry about the back end. Who's trying to pull the strings? Who's trying to, to push an agenda, most of which I don't want to rush to judgment on because I don't know anything about. But there are so many agendas flying around from the left, from the right, from the Chinese, from the Russians, with everybody ability to having the ability to kind of mix in through social media, in masked ways that make it hard to figure out who's actually trying to get what done. Very dangerous.
Let's go to the coronavirus. There's one thing is for sure is that virus, that disease has not left us. It is still a tremendous risk for everyone in the world, and obviously for folks in Rhode Island. Take us through the numbers.
Sure. Around the world, we are at 6.4 million cases, going up around the world, 100,000 positive cases a day, which will turn into 5,000 to 10,000 deaths a day before long. The sort of good news is that we're in the 3,500 deaths a day. I mean, think about a world in which I say 3,500 deaths a day is good news because we're going up to 5,000 to 6,000 deaths a day. But that's about what's happening around the nation. We keep climbing at 2,000-ish deaths a day, at 20,000, 20 to 25,000 deaths a day, which will also, turn into something like 5,000, at least 2,000 to 3,000 deaths a day before long. I fear the good news was over the last few days that we were, quote, only at 900 deaths in the last 24 hours. That
in the United States.
In the United States, that's feeling good to us. What a world. In Rhode Island, we have seen a drop-off relatively in the number of new cases. About 101 new cases in the last 24 hours. And we actually have to start being careful because some of what are being tested as new cases are likely to be people who were positive before, are being retested, and are still positive. There's some evidence now that positivity hangs around for 3-4 weeks, even though a person is only infectious usually for about 9 days. So some of those numbers may actually be even a little inflated. Unfortunately, 12 more deaths in Rhode Island for a total of 732 deaths in Rhode Island alone. Our hospital numbers are coming down gradually, and that's a good thing. But let's see what happens over the next couple of weeks as we see more movement and more interaction.
Are we starting to get a sense that the better, warmer weather is curtailing the spread of the virus? Can we make that? I know we don't have pure data for this, but just looking at this with some common sense, we saw warmer weather states open much earlier, have less restrictions, Dallas and states like Florida, et cetera, and they seem to have not seen the spikes that we obviously saw in the early part of the spring, the end of the winter in the Northeast.
Well, there were the general projections suggested we'd see a drop off at the end of May, a fairly intense drop off, which we're seeing. And whether that's because of the warmer weather or whether that's because of the timing of the virus and how it has progressed through the population in a predictable way is a little unclear at the moment. I'm glad to see the drop off at least locally, but remember, we're not seeing that drop off nationally yet. You know, little drop off in the number of deaths, but not a drop off in the number of new cases. So again, I got to say, time's going to tell, and I can't tell what's causing what. I'm glad to have the reduction, but we have to remember this virus is still here and able to pass back into the population. You know, I kind of, my instinct is having people be outside is better than having people be inside overall, and maybe that's helped. But again, time will tell.
Dr. Fine, are we going to see, just because of the loosening of restrictions in almost every state in the country over the last week to 2 weeks, protests across the country and lots of physical interaction, are we going to see a spike no matter what we do in 2 weeks just because of the amount of human interaction increasing versus the lockdown periods?
Again, hard to tell. You know, the bad news is we have more interaction. The good news is more of it's outside, where there's dilution of some of the sort of the intensity of the viral, funny to use this word, but contagion. The concentration of virus in the atmosphere is much less when you're outside. You know, it's not like somebody gets sick, comes home, and spreads it to their, you know, to their family members who are all inside. Now we've got windows open, we've got people outside. So, you know, could we? Yes. Will we? Time will tell.
Dr. Fine, Rhode Islanders have a lot of things to deal with right at the moment. As difficult a period of time as I think any of us have seen, we now have a national death count that is, I believe it is now twice the number of Americans lost in the Vietnam War. You get the last word. How do we stay above the fray? How do we stay positive? How do we be good Rhode Islanders, good neighbors, good friends?
It's time to reach out and talk to each other. You know, to take care of each other. You know, to wear the darn masks, because that's the way we take care of each other, and to slow it down so we think before we act and make sure the information that we're acting on is real and not alternative facts.
Dr. Michael Fine, I want to thank you again. For everyone else, stay up to date on GoLocal. There's a number of aspects of the developing stories that will be updated over the course of the afternoon. We'll continue to cover this into the evening as things to develop. And of course, please stay safe. Thank you.
Thanks, Josh.